Good afternoon, and thank you for joining us for the COVID-19 briefing for April 2nd. And joining me again is interpreter Sharon Sinkler. Thank you, Sharon, for providing your services so that all members of our community have an opportunity to understand the information we're providing during these briefings. We want to remind everyone to visit our website at covid19.lincoln.ne.gov, where you can learn more about how to protect yourself, your family, and all of our community members during this pandemic. Nebraska has now lost 5 residents to COVID-19, and we want to express our condolences to their family and friends. Here in Lincoln, we have 3 new cases confirmed today, bringing the total of lab-confirmed cases to 12. Of the 3 new cases today, 1 case is travel-related, 1 case is from a close contact of a COVID-19 positive individual, and the investigation is ongoing with the 3rd case. The travel-related case is a man in his 60s who returned from Spain on March 24th. He followed the recommendations and self-quarantined at home upon his return to our country. He developed symptoms on the 26th, and he remained self-isolated. The second case is a woman in her 40s who is in the same household as a person who has been confirmed positive with COVID-19. She also followed the recommendations and has been self-quarantining. The 3rd case, an individual in their 60s, is still under investigation, and we are currently gathering more information. We will provide that as soon as we are able. But what I want to say about these first 2 cases is that this is evidence that our community is taking this seriously. They are following the guidelines provided by local health officials, and we can't thank them enough for that. These first 2 individuals self-quarantined, one because of travel and one because of a sick member in the household, and in doing so, they have protected the rest of us in this community. They're doing what they're supposed to do, and that is the kind of compliance we want to lift up and recognize and acknowledge as exactly what we need to get through this pandemic together. Here to provide more information about the investigations is Interim Health Director Pat Lopez.
Good afternoon. In Lancaster County, we now have 495 negative tests, and we currently have 14 pending tests at the Public Health Lab. The Health Department is also monitoring 99 individuals due to travel history or exposures. Nebraska now has 246 cases and 5 deaths, as the mayor shared. You will see online that we are posting the case totals from both the Public Health Lab and also from our private labs. In other words, the Health Department reports Lancaster County testing results from all labs, the Public Health Lab and the commercial labs. We don't have access to the report the number of pending tests from the private labs. The pending test numbers we report only are those for the Public Health Lab. We are expecting to see increasing numbers of positive lab-confirmed cases over the next week to 10 days. Certainly, the increased lab capacity is helping to identify more cases. It has now helped with both CHI and Bryan having more options for testing. As a reminder, the drive-through COVID-19 testing will continue to be focused on the following high-priority populations: healthcare workers, first responders, those working in nursing homes and correctional facilities, and residents of nursing home, group home, and vulnerable populations. The process to be tested for COVID-19 includes completing a brief questionnaire at bryanhealth.com or chihealth.com. The questionnaire will be reviewed by a healthcare professional, and the person will be contacted to determine if testing is warranted. If testing is recommended, the person will be given a doctor's order and an appointment for drive-through testing site, or the person may have their own physician order the test and make the referral. The person will be tested and then asked to self-quarantine until the test results come back. The person will be contacted with the results of the test, and if the test comes back positive, they will give further instructions at that time, and we are notified so that we can begin an investigation. I'm going to turn it back to the mayor.
We're going to continue with the steady drumbeat of a public health message that is designed to protect our community, save lives, and prevent our healthcare system from becoming overburdened during this pandemic. And we want to reiterate the clear message we want everyone to take home, which is that all of us should be staying home as much as possible. From the very beginning of this public health emergency, we have stressed in particular that those who are sick or symptomatic with COVID-19 symptoms, again, those symptoms are fever, a dry cough, or shortness of breath, they need to stay home to protect themselves and others. Unfortunately, most people who develop the symptoms of COVID-19 or who have it will not experience a life-threatening symptoms, or then they will be able to recover at home without medical care. The way that you and those in your household manage that recovery at home matters so much to our community. So as a reminder, here's what you need to be faithful in doing. A sick person should stay away from other people. This means they should stay in a specific room in the household and try to have a separate bathroom that they use if possible. Surfaces that are touched should be cleaned daily. And just as important, the family members or others living in the household need to stay home and quarantine as well. You should contact the health department for more guidance on your particular situation if you or someone in your household is ill. The health department hotline for advice is 402-441-8006. And you can get more information as well at covid19.lincoln.ne.gov. As Director Lopez said, as more testing becomes available, we will see the lab-confirmed cases in our communities start to rise. We will have many new cases reported to us by the labs many times a day. And so to avoid confusion and to make sure we're providing the most accurate numbers possible, we're going to change the way we report. And here's what we're going to do. We're going to report Lincoln's totals twice a day, with releases to the media. So once in the morning and once again at these 3:30 p.m. briefings. We will, however, update our website as the new cases are confirmed. So those will continue to have a real-time update. And that website, again, is covid19.lincoln.ne.gov. We will, of course, if we need to, announce any information as warranted related to these cases in real time, because our goal is to provide the most accurate and up-to-date information so that people can protect themselves and their loved ones. Today, our briefing is going to focus on a very important topic. This is maintaining our mental health and well-being. The challenges and uncertainty of this moment naturally impact people's mental health, and we are seeing that in some of the data that we routinely gather at the city. Through the first quarter of this year, the Lincoln Police Department has seen a 32% increase in mental health calls compared to the same time period in 2019. It's certainly natural to feel stress or grief or worry during an emergency like the one we're going through right now. Right now, many of us are experiencing fears or worries about our own health or the health of the people we love, changes in appetite, energy, and activity levels, maybe some difficulty concentrating, maybe some of the chronic health problems people have feel like they're getting a little worse. We see people that will increase their use of alcohol, tobacco, or other drugs. And so we want to acknowledge that it's normal to have these feelings and experiences. And while this is a difficult time for all of us, it may be especially difficult for certain members of our community. And this includes seniors, individuals who are at high risk for COVID-19, children and teens who've never been through something like this, people on the front lines of the virus response, and those who have previously experienced mental health challenges and problems with substance use. So if you are listening and you need help, there are many resources available to you in Lincoln. We are a strong community and we know how to heal people. I'd like to welcome some of the folks who do this wonderful work in our community to help share their messages of hope and allow their services to be made more widely known if you feel that you may want to access them. First, I'd like to welcome to the podium Topher Hansen. He is the Executive Director of Centerpoint, and he'll share some information about mental health and substance use services that Centerpoint provides.
Thank you, Mayor. I have about an hour, No, I'm kidding. One of the things that we all need to do, the first job that you have every single day is avoid the virus. That's number one. The second thing is to remain upright through this process, and that's going to come by you working yourself in your environment to take care of yourself. And then if in doing that you still need help, help is available and you can contact resources in the community, and I'll get to those in a second. But the thing about remaining in your environment, it's probably a new situation for you. And so to do that and keep the integrity of not going places and being in contact with other people to the extent you can is important. But it is, however, really important that you stay connected to other people in ways that you need to do that. So if it's by telephone, if it's by Zoom, if it's by FaceTime, however you do that, or you can learn to do that, that's important to maintain your relationships because we all have that need for a connection. So maintain that and try and keep your heart happy as you go through this. Maintain your routines. Human beings love routine. You hear that about kids all the time. We got to give them a routine and stick with it, but adults need the same thing. So find your new routine. If it's working from home, get up, take a shower, get dressed just like you're going to work. Maintain all of those things that you do in some fashion to maintain your routine. If you can do that in a way that you feel like you have a structure, then that's a good thing. Don't let it just wander and be aimless. That's not going to do your mental health as much good. If you have to incorporate new things, then you have a new routine, and you'll need to adapt and be resilient that way. Take care of your body. So you can do things in your house to take care of your body just by walking around. I had a daughter, Ellie, who was running around our house just trying to get her steps in and also getting some aerobic exercise in that process. You can also do other physical activities in your house that will help you burn some energy and take care of who you are, or go outside if the weather permits and you can distance to walk or ride or other things like that to maintain your health. Super important to do those things. Practice stress management tools. This is game time. We're in the game right now, and it's really important that you understand that you get to control how you react to this. And so to try and do things that help you relax, whether it's to breathe by yourself or meditate or read in a way that helps you to relax, but take a breath. Know that what your brain does in situations like this, where you have something you're anticipating, is it tends to escalate the amount of horror that you think you're going to incur. And so while it's going to be like, oh, this is going to be the most terrible thing ever, what happens, and studies show this, what happens is it comes to be about like that. So don't escalate the situation. Let it happen as it can come. Don't build up your anxiety around it. If you can relax in ways to not keep thinking about the future. That's what human beings have, that capacity to plan and think about the future, and we tend to worry about those things. So figure out ways that you can relax around those and just take moments as they come and try and ease your level of stress. If doing these things still puts you in a position where you feel like your mental health situation is not stable, that you're engaging in behaviors that aren't productive to you, get help. Help is readily available. So there are several different ways you can do that, one of which is Centerpoint operates a crisis line at 475-6695. That's 475-6695, 24 hours a day, 7 days a week, and you can call and talk to somebody to get the care. If you need outpatient or crisis counseling, you can go to our center at 1000 South 13th Street, which is 13th and E, right catty corner from Runza on 13th Street. And you can walk in and get help right then between 8 in the morning and 5 at night. The other would be to contact get on the Centerpoint website, which is www.centerpoint, which has an E on the end, centerpointe.org, and look at the resources there, one of which is a link to online application called MyStrength, and has a myriad of material around COVID-19, around mental health, substance, physical health, all sorts of things that you can use to educate yourself and then also learn to ease your stress. I know other providers are still available in Lincoln. The Health 360 and Lutheran Family Services is operating now, as are other providers in town. So seek the help if you need the help. If you're in your house and want to do it, access that Centerpoint website and the MyStrength application, which can keep you busy all day long learning about things and helping to control your situation. So remember, the first thing is we got to avoid the virus. And the second thing you have to do is work hard like an athlete works hard to get through this thing standing upright and being a strong person in the end.
Thank you, Topher. Yes, we are so fortunate in this community to have providers like Centerpoint, and there are so many resources that you can look to, and I'm going to highlight just a few others. Each resource that we share today will also be listed on our website at covid19.lincoln.ne.gov. The Mental Health Association's Kia House staffs a 24/7 warm line at 402-261-5959. Again, the Kia House's warm line is 402-261-5959. They have resources to assist those living with mental health or substance use issues. Cedars assists children and families who are struggling, and they are a resource for families in crisis. Their hotline is available 24 hours a day, and that is 402-436-5437. Again, Cedars hotline 402-436-5437. And finally, The Bridge offers mental health and substance use counseling for those in need. Their hotline is available 24 hours a day, and that number at The Bridge is 402-477-3951. There's really never been a better time to reach out if you feel the need, and there are many people waiting to answer your call. Up next to share some additional recommendations and resources is Councilman James Michael Bowers. In addition to representing Northeast Lincoln on the City Council, Councilman Bowers is a practicing social worker and therapist.
My name is James Michael Bowers, and like Mayor said, I'm a member of the Lincoln City Council, and I'm also a practicing social worker and therapist. Providers in the mental health community have been in discussion about how we can best serve the needs of Lincoln and Lancaster County, and we want to be very clear. The emotions that you may be feeling, fear, anger, grief, are all normal responses to the abnormal situation that we're finding ourselves in. Many of us may be isolating ourselves from other people and have an interruption in our daily routine, which is leaving more time to focus on things like the news and social media. And it is normal to feel that you're not handling this unprecedented time as well as those around you. But please remember that when you see things on social media, it is not a factual representation of the person's life, and what you're experiencing may be more common than what you think. The mental health community would like to share some tips put together by providers in Lincoln. As mentioned before, please stick to a routine as much as possible. Having regular sleep, work, self-care, and at least 30 minutes of movement can help keep a sense of normalcy and structure. This can benefit our children as well. Consistent expectations and routines help children know what's coming next, what to expect, and helps them feel safe and reduces their anxiety. In your schedule, try to find 30 minutes a day that you can spend reaching out to others. We've all heard the phrase social distancing, which means that we need to stay home in order to prevent the spread of the coronavirus. And if we do need to leave our house, that we keep at least 6-foot distance between ourselves and others. But it doesn't mean that we should shut ourselves out from other people. Another phrasing that I've heard has been, we need to start thinking of it as more as physical distancing, because it's important that during this time we continue to reach out to one another through letters, phone calls, and technology to combat isolation in a safe way. And as we fight to flatten the curve, preventing loneliness can help reduce the fatigue of staying at home. It's important to strive to give grace to those around us, adults and children alike. This is going to be a hard time for everyone, and we're all going to struggle when we experience a challenge in our daily routine. Everyone is doing their very best, and we're all going to have a moment where we're not going to be the most patient, calm versions of ourselves. And by providing grace and assuming positive intent of others, it's going to help ensure that we have it on our hardest days and reduces needless arguments and unnecessary stress. Providers in the mental health community are ready to serve and meet the needs of your city and county. Please do not hesitate to reach out to social workers, therapists, and mental health practitioners to process through what you're experiencing. Many providers have moved to telehealth, which means that they're using technology to see clients. Some are offering sliding scale fees, and all are committed to helping our neighborhoods. Cassandra Liao has been instrumental in organizing mental health professionals across the city to offer free 50-minute mental health sessions to those in essential services who continue to serve us during this pandemic. And you can get more information and register at tinyurl.com/mentalhealthnebraska. If you do feel like that you're having thoughts of harming yourself or suicide, please do call 911. The Substance Abuse and Mental Health Services Administration also has a disaster distress helpline available. It's a toll-free, multilingual, and confidential crisis support for those who are experiencing emotional distress related to a natural or human-caused disaster. And their number is 1-800-985-5990. And that number again is 1-800-985-5990. Or you can text Talk With Us to 66746. You're not alone, and we're going to get through this together. Please reach out if you need help.
Thank you so much, Councilman Bowers. There's been a lot of great tips. The CDC is also offering a number of guidelines that can help manage your well-being and maintain mental health. And I want to share some of those points. To reiterate, it's really important to take breaks from all of the social media and the news about the pandemic. Hearing about it repeatedly can be upsetting. And instead, at the end of your day, turn it off. Take time to unwind and remind yourself that these strong feelings are going to fade. The pandemic has an end. We will get through this. And it's important to try to continue to pursue some of the activities you normally enjoy, even if they are within your home. It's also really important to take care of your body. Take deep breaths, stretch, meditate, find ways, take a self-inventory, and find ways to keep yourself calm. Try to eat healthy, well-balanced meals, get your sleep, your exercise, and avoid alcohol and tobacco and other drugs. Connecting with others is so important. We don't want this social distancing to lead to emotional distancing. Keep talking to people you trust. You can tell them your concerns and how you're feeling, and you can also be an ear for other people. And if you take anything away from this briefing, please let it be that you seek help when needed. Feelings of stress or anxiety or fear will continue to impact our daily lives in the coming weeks, and it's really a good decision to reach out to someone you trust, whether it's a faith leader, a doctor, a counselor, or a family member you trust. And if you are feeling overwhelmed, remember CenterPoint's helpline that Topher mentioned. It's always available, 402-475-6695. Again, all of this information will be posted online at our website, covid19.lincoln.ne.gov. Finally today, we do want to share some more information about the great ways that our residents are taking care of one another, because that is so important for our well-being as a community, and it's very hopeful. Community Action announced today that the Gathering Place Soup Kitchen will begin to offer weekend meal service starting Saturday. Free hot, nutritious meals will be packaged in to-go boxes and available for pickup between 5 and 6 p.m. at 14th and East Streets. The Gathering Place had planned to start offering meals 7 days a week in May, but they moved it up to meet the needs of the community during this public health crisis. And I want to thank the Community Action, the Gathering Place, and Lincoln Rotary 14, which is volunteering to help with the first weekend of this expanded service. It's really inspiring to see how people are adapting and evolving to meet the needs of our community during this time. Earlier this week, we asked children to connect with our homebound seniors by sending them notes and art through the Sunshine Kids for Seniors project. We started sharing some of their artwork yesterday, and we had a few more to share today. If you or someone in your family wants to participate, you can send your scanned notes and cards and artwork to sunshinekids@lincoln.ne.gov. Again, we want to make sure that those folks, those seniors who are staying home and staying safe, still feel connected and have messages of hope from younger folks in our community. At this time, we'd be happy to open up for questions. We have our health director here, again, folks from Centerpoint, Councilman Bowers, and others. So if you have any questions, please.
I have a question, if you don't mind, Mayor. Bill Shammer with 1011 Now.
Hi, Bill.
I hope everybody's doing well, first of all. I've been crunching the numbers a little bit, and it seems the statewide positive testing rate is about 5.5%, whereas Lincoln's rate is hovering right around 2%. Do we expect to catch up to statewide numbers, or how can we explain the difference that we are seeing in our community?
I'll let the health director take this one, but it is clear, just looking at a map of our nation, that different places are experiencing the pandemic differently, in part because of the density of their communities and the close proximity with which people live, in part because the virus arrived in their communities through international airport hubs earlier than in other areas of our country, and that some places like Lincoln, Nebraska, got to watch what was happening on the coasts and learn, and had more time to prepare than some of our friends on the coasts. And so the key is to remember that social distancing, or as I think Councilman Bauer said, the physical distancing measures are so important, and they are the key to managing this pandemic while we wait for a vaccine to be developed. But if Director Lopez wants to try and answer that question about the numbers, city versus state, I'll let her take that.
I think just to add to what the mayor said, I can't emphasize enough how important that information is, that we started early, we learned from others, and we practiced the measures that would really help us keep our curve lower, and we're seeing the positive results of that. Now, we do expect that we're going to see a change in numbers now that we have more testing available. I anticipate that we'll see an increase, but we hope it'll be more of the gradual increase and then move forward from that area.
Riley Johnson with the Journal Star here with the next question.
Hi, Riley.
Hi. There's been a lot of discussion, at least online and nationally, about the value, efficacy, public health effectiveness in stay-at-home orders. And the governor today was talking more about his view that for Nebraska, for now, that shelter in place is not a policy that needs to be implemented statewide. Mayor, do you share the governor's view on that reality for Nebraska communities, that we don't need a shelter in place right now?
Well, to reiterate what Director Lopez said, we took a lot of really important, bold moves early on, and many of those are consistent with shelter in place or stay-at-home orders. You know, universities and school districts closed. The limits on public gatherings limited to 10 or fewer people, and encouraging as many people as possible to telework, taking our restaurants and bars to takeout only. These are some of the most effective and aggressive actions that you see in an order like that, and we implemented them early. That said, you know, we're assessing this on a daily, hourly, minute-by-minute basis, and as someone who gets up every day and thinks about how to protect the community, our team is considering all options on the table.
Bill Shammer again here, Mayor, from 1011. Some of the national models have shown that Nebraska really isn't going to peak until, you know, the last couple days of April or the beginning of May. Is it your strategy right now that we are still, at least here in Lincoln, in the very early stages of COVID-19 cases?
Well, I think we're in the phase where cases are starting to gradually rise. So we're definitely not at the peak, and we're definitely not over the peak. So yes, I would say that we're in the beginning. And of course, our efforts and all of the measures that we've put into place, and the incredible compliance and cooperation from our community to stay safe, to try to stay at home as much as possible. I want to thank the public for making this happen with us. We are doing our best to flatten the curve so that we don't overburden our healthcare sector. We don't want the capacity of our hospitals to be exceeded by the number of cases. And so, of course, that's a metric that we're paying attention to each hour. And we're in constant communication with the healthcare sector, with our community response leaders, and with the other folks who are serving the most vulnerable populations in our community. We can't take our eye off the ball. We have to continue to practice the social distancing. These are measures that are going to be in place for weeks, if not months, and the more faithful we are to them, the better chance we have of being able to ease up on them sooner rather than later. But there's, as to paraphrase Dr. Fauci, the virus dictates the timeline, not us.
Riley with the Journal Star.
Yes.
Hi. What has the city's experience been in acquiring that PPE, the personal protective equipment? And what is who are the intended recipients for the sort of masks, gloves, those kinds of PPE that the city has sought?
I'll bring Director
Up
Lopez.
to give more specifics about that because her team, through the incident command structure, is coordinating efforts for our community. But like every community across the United States, no one has enough. We all wish we had more, and we're working around the clock to try to secure additional personal protective equipment so that we can make sure that when people walk into that ER to take care of patients, that they have what they need, to make sure that our first responders have the equipment they need. These people are heroes, and I cannot thank them enough. The people who are showing up in our hospitals in the face of this very contagious disease that has no vaccine, they're doing heroic work, and we all need to thank them for their courage and their dedication. They are taking care of people no matter what. And the folks at the city who respond, and for our first responders, our emergency medical response, our firefighters, our police, they're coming to work every day when others are getting to telework. And that's a gift that they give to our community. It's out of their sense of duty and obligation to something, a purpose higher than self. And if you get a chance to thank a first responder, please do, because they are making sacrifices that are being asked of, none of the rest of us are being made to ask. We are asking sacrifices of our first responders and medical community that the rest of us are not being asked to make. And it's another reason why it's so important that when you get tired of being reminded to wash your hands, to keep 6 feet away, just remember that that's what we're being asked to do when others are being asked so much more.
Riley, we have been working for some time now with all of our healthcare facilities and providers in the community and collecting information about what kinds of, as you said, PPE is needed, and working to access those supplies where available. We have a process in place so that the healthcare community can notify us of what they need. Then we try to source that and get it back out into the community with them. And we're doing everything we can to extend the life of what PPE we have and move forward any PPE we receive. The state has put in a large order. You may have remember last week that the governor's emergency fund was established by the legislature, and they immediately contacted us across the state to see what our PPE needs were, and they've put in a large order. Of Of course, that doesn't mean we're going to get it, but we continuously work and look at other resources. And we've had to establish our priority areas. Of course, we want those first responders and our frontline staff to have access, and our nursing home providers and others. But we continue to work with all of the healthcare providers in the community in a variety of settings, not just the typical physician office or long-term care center, to make sure they're able to continue to serve the people that they're working with.
As a follow-up to that, does the health department anticipate distributing masks or similar types of facial coverings, gloves to the general public? And or what recommendations does the health department have for people this time about the need to cover their face and protect, wear gloves when they're going to the store or going to get gas?
Riley, we're looking at, as that information changes, the mayor said, things sometimes change in minutes or hours. We know that there's some national look again at doing the face covering. We're exploring that option and what that would mean and what resources that would take. We certainly know that we don't have access to enough masks for our first responders and healthcare providers and gloves. So that's our primary concern, but we're also looking at how do we continuously keep the public safe.
This is Bill again for a question for the mayor. Mayor Gaylor Baird, I know you yourself are a parent. Do you have a message tonight for parents, or even a suggestion as they are now coming to terms with the fact it'll be at least June 1st, based on the governor's order, before children and kids can really get out of the home, outside of going outdoors and social distancing, but that buildings are now closed for another 2 months.
Yeah, well,
I have a lot of faith in the resilience of our children, and often they can be an inspiration for us as adults. It's important that kids get exercise. It's important that you check in with your kids. It's important to see how they're feeling and listen to them and let them talk. It's also important to still have expectations that they are doing what they need to do to take care of their home responsibilities, to take care of their learning responsibilities. Kids are not on vacation, and the LPS is doing its best to provide continued education and learning opportunities. And, they're living history. And I think it's just important for them to understand that, no one's ever been through this before, but we will get through this together. Pandemics come to an end. There will be an end. We're in a really unusual situation right now, but it will change and life will get better and we'll get through it together.
there's actually something else.
Say about kids, and that is that in my meeting today, we have a meeting of mayors from across the country. Over 140 mayors get on a Zoom call with the Bloomberg Harvard City Leadership Initiative, and we have folks from Johns Hopkins University and public health professionals on that. And the question of youth came up, and I was reminded that youth listen to youth more than they listen to adults. And I think that if there are young people out there watching right now, or if there are parents who want to talk to their teens about spreading the public health messages amongst themselves, like that is one way that youth can be deputized to help us and be strong and resilient through this challenge. If you're a youth with a lot of Instagram followers, if you want to post about why you're staying at home and what you're doing to keep your family safe and what you're doing to protect your grandparents, you could have the chance to help save lives too. So really, this is a time for leadership amongst our young children, and I would call upon them to show that leadership and be a part of our solutions and our successful road to recovery.
Other questions? Okay.
Thank you so much for tuning in. Thank you for listening and helping us get the word out. Stay safe and healthy, and we'll see you tomorrow.
Thank you.